What's up, friends? Welcome back to another video on the shoulder. Last time I taught you guys how to simply assess your shoulder in terms of range of motion, both actively and passively, to help you determine whether or not the issues giving your impingement is from an active structure or a passive structure. Today, we're going to dive a little bit deeper into what might be causing those discomforts. For example, we're going to test certain structures. Now, the only caveat to this is that I want to say is that it doesn't really matter. At the end of the day, regardless of what's happening in your shoulder, we need one of two things, whether that be improvement to range of motion or improvement to strength of your shoulder. And that's how I like to simplify shoulder injuries to my patients, and that's how I want to teach you guys. Because honestly, it doesn't really matter if you have a slight strain of your shoulder rotator cuffs or if you have a stiffness of your shoulder joint capsule. If you apply these principles to whatever it is that's affecting your shoulder, it's going to get better in the long run. So whether that be mobility or strengthening. Now, with that out of the way, I'm going to teach you some really simple special tests that we run in clinic. Obviously, it's a bit easier when somebody else is doing it to you, but our purpose here is I want to teach you how to do this yourself so you can skip going to the physio, or at least maybe test it yourself to kind of understand what's happening to your shoulder yourself, and maybe give you a better understanding if you do have to go to the physio or chiro or other health practitioner to help you get to that next level. Because at the end of the day, rehab, it really isn't that complicated. This is where we make rehab easy again. So the first test we're going to test today are going to be testing for impingement of the shoulder. Now, I want you guys to understand that impingement isn't diagnosis. Impingement is just a sign of something that's happening in your shoulder. For example, impingement just means there's something being pinched between the space of your acromion, which is part of that shoulder blade, and the humeral head, which is the part of that arm bone here. So something's pinching that space in between there, leading to what's known commonly as impingement. So again, impingement is not a diagnosis. We can't be like, okay, I'm going to diagnose these with impingement. It's actually, impingement is a symptom of something else going on. So these tests are going to help you determine whether or not you actually have an impingement, or if you are testing negative, it may be an indicator that you're not having any kind of impingement in the shoulder. So it could be something else that's happening in your shoulder. So test number one we're going to do is something called the Hawkins-Kennedy test. Now in clinic, I would test this on you or my patient, but in your case here, what you can do is test this on yourself. So you're going to take your shoulder up as far as you can in front of you, like 90 degrees this way. And all you're going to do is use your other hand. You're just gently going to rotate it downward as far as you can. Now, what you want to prevent is having that shoulder raising up towards your ear. Keep that shoulder level and rotate that inward as far as you can. Now, if that reproduces any kind of pain or discomfort or pinching through your shoulder, that's an indicator of a positive Hawkins-Kennedy test. So you can test your right side and you can test your left side. Is there any difference between your left versus your right in terms of symptom reproduction or range of motion? The second test I'm going to teach you guys is called the Near test. Near's test, we're just going to do very similar positioning. We're going to internally rotate our shoulder, and we're just going to use our other hand, our unaffected arm, and we're just going to lift that up into an abduction position. So you can do it in this position here. And very similar to the Hawkins-Kennedy, where you're rotating it, we're just going to shift it upward. And again, any reproduction of painful symptoms. I know some people like to do it where they have their arm on their opposite shoulder and lifting their shoulder up like this to reproduce impingement. I like to kind of go up like that and see if there's any kind of pinching, reproduction of pain or discomfort. And if there is, you can compare left versus right. A positive test would be pain, reproduction of symptoms, limitation to range of motion. And again, best way to do that is just compare your left side versus your right side. All right, next, we're going to test for something called a SLAP lesion. So SLAP, S-L-A-P, stands for superior labral anterior to posterior lesion. So it just means that the labrum has some kind of tear in your shoulder. So for this one, we're going to do a test called the O'Brien's test. And basically, we're going to do this in two different steps, step one and step two. So for this one, you're going to take your affected shoulder, take it up to about 90 degrees of flexion. You're going to bring it inward slightly, about 5 to 10 degrees, and you're going to internally rotate your shoulder as far as you can this way. Already, if this is causing any pain or discomfort, just stop and then consider that a positive test. If not, from here, what you're going to do is use your other hand, place it on your wrist, and you're going to resist an upward force going this way towards, let's say, my opposite shoulder or opposite ear. So going up into this almost 45-degree angle in that position of flexion, slight adduction, and internal rotation. I use my other hand, pop it on the wrist, and push up. Gentle pressure. Any positive sign or any positive pain is a positive indicator of a O'Brien's test. Now you can do the exact same thing here, same position, palm up, push on wrist. Now if that, again, we're doing that same kind of motion into this 45-degree angle upward, if this is not giving you discomfort, but your internally rotated pain test is testing positive, then that's a positive test for O'Brien's test. And again, that might indicate, I like to highlight, might indicate a superior labral anterior to posterior or SLAP lesion in your shoulder. All right, so the next test we're going to test is going to be for your AC joint. So the AC joint is just that joint between your clavicle and your acromion, part of your shoulder blade or your scapula. So, I mean, one test you can always do is just kind of press on that position. Like you can follow your shoulder blade or your collarbone all the way down to that area where you feel a bit of a lump. And generally, that's where the joint is between your acromion and your clavicle. Now, just adding pressure into that position, does that hurt? If that hurts, that's a positive sign for maybe a positive AC joint test. Now, another test we can do here is taking your arm at this 90-degree motion. And what you're going to do is you're going to put your opposite arm, again, if I were in clinic, I would do this for you guys, but you take your opposite arm, put it on the elbow, and you're just going to resist that horizontal extension of the shoulder. So you're going to pull here and pull across, or you can do it back here as well. Now, a positive test would be pain right at that shoulder where you're having discomfort. And again, it might indicate that you have an AC joint dysfunction. So again, we're going to go up here, 90 degrees, hand resisting the elbow and pushing into my hand across the body this way. Positive test would be pain and discomfort at the AC joint there. Now, as a side note, a lot of these special tests are not really special at all. I don't know why they call it special tests, but realistically, these tests are not special because they don't tell you what exactly is happening. In order for you to determine what's happening through your shoulder, you needed to have a battery of tests included with your subjective assessment in terms of what happened to your injury or how you sustained the injury, but also multiple tests that kind of help you rule in or rule out different symptoms or ailments of your shoulder. And that's true for anything in your body. You're not just going to do one test and it's not going to tell you exactly what's happening. So in this case here for our SLAP lesion, we're doing this resisted horizontal extension of the shoulder and testing if there's any positive discomfort at the shoulder AC joint. But you can also combine this with the O'Brien's test, which is the one we just did previously, and compare that. So again, the O'Brien's test can test for your AC joint as well. And that's what I mean. They're not specific to any one ailment. The O'Brien's test we tested earlier was to show you if you had a SLAP lesion or potential for a SLAP lesion. But we can also use this to test for an AC joint discomfort. And you can combine these. So if your resisted horizontal extension is positive, as well as your O'Brien's test, okay, we're thinking maybe there might be an AC joint discomfort here or dysfunction here. You combine that again, oh, I'm really tender right at the AC joint. Ding, ding, ding. AC joint could be a potential injury here. This is where I'm going to ask you guys to pause and just kind of look at your notes. As you're doing that, I want you to consider hitting that subscribe button down below if you're finding this information useful, because it does help me grow the channel. And I want to reach as many people and help you guys out as much as I can, because it's great that I can help people in clinic. It's great that I can help people one-on-one, but YouTube is such a great way to reach hundreds of thousands of millions of people, and people who can't always get to the physio or afford physio or get their healthcare that they need. But I want to help as many people as I can. So please consider hitting that subscribe button down below and like this video as well, because it does help my channel grow and help more people in the future. Thanks, guys. All right, so far we've tested for shoulder impingement. We've tested for SLAP lesions. We've tested for AC joint discomfort or pain. The next one that I find commonly affecting the shoulder, especially in my clinic, especially for athletes who like to do a lot of throwing and overhead motions, is the biceps tendon. So the biceps tendon comes up right through the front of the shoulder and attaches into your coracoid, as well as that kind of superior aspect of your shoulder joint. So it can be associated with a SLAP lesion as well. So the two main tests that I'd like to test for the biceps tendon would be, number one is going to be the what's this called? The speeds test. See, even for me, I do these every day and I'm forgetting the names of these because there's so many damn tests out there. That's what I mean. They're not special at all. I barely run through all these special tests, honestly speaking, but it is nice to kind of combine this with my subjective findings as well as other tests throughout the clinic to help me determine what's happening to the shoulder. So for the speeds test, what we're going to do, I like to do this where your arm is out straight, For this one, try not to have your shoulders slumped forward. I want your shoulder blades back nice and tall or nice and straight. Your palm upward. And again, we're gonna do an upward resisted motion. So using your unaffected arm, you're gonna place on your wrist. And from here, you're just gonna push upward with a straight arm and see if that reproduces any kind of pain and discomfort through the front of your shoulder. And again, if it's right along that bicep tendon, if you can feel it, that's a good indicator that it might be the bicep tendon that's giving you the pain and discomfort. Combine that with subjective findings, of course. And guys, look at this. I mean, my speeds test here versus my O'Brien's test here versus my other O'Brien's test here. Look how similar they are. That's what I mean. These tests are not special, but they do help a little bit along the way. So speeds test, good one to test for pain and discomfort of the biceps tendon. The second one that I tend to use occasionally would be the Yergenson's test, but again, I don't find this one as effective. That being said, I'll teach you guys anyway. So this one, the bicep does two motions, or a few motions actually. It does obviously bicep curl, so we're doing our elbow flexion. It does shoulder flexion, and that's similar to what we were testing in that speeds test motion. But it also does supination, the little known supination movement of the biceps. So multi-talented muscle. In this case here, what we're going to do, we're going to have our shoulders and elbows tucked in. We're going to have our palm down. Other hand's going to grab our wrist. And we're just going to resist this upward supination motion of the wrist and arm. So here, grab the hand. I'm going to turn my wrist upward and resist that. Now, because we're activating our bicep to help pronate the shoulder, that can cause pain and discomfort at that bicep tendon. Again, in clinically, I haven't found that to be that useful. But again, we're using a battery of tests here to see if multiple tests are positive. That would lead to a higher likelihood of, let's say, for example, in this case, a biceps tendinopathy. All right, so we've gone through 4 different potential causes of a shoulder pain and impingement, and we've gone through multiple tests for these different ailments. Leave me a comment in the comment section below. What have you found positive for you so far? Has it been all of them, none of them, some of them? What's leading you to believe what you're dealing with is, say, a shoulder injury, or a biceps injury versus a AC joint injury versus a slap injury? Let me know, because I'm curious. Now, you're probably asking, what about my rotator cuff muscles? Well, I kind of tested those ones in the previous video. So if you're interested in learning how to test your rotator cuff muscles, check out this video up over here, because I teach you kind of how to test your rotator cuff muscles at the same time testing your range of motion. So for special tests, check this video up over here. And that's it, guys. I'm just going to go through those 4 different types of injuries to the shoulder because, I mean, honestly speaking, I can go for hours and hours and hours on the shoulder because I love the shoulder. Main reason is because I have a shoulder injury myself. But that being said, let's simplify it, keep it easy. Like I said, rehab is not difficult. Let's keep it at these 4 special tests. If you want a specific test to test for certain aspects of your shoulder, please let me know which test you want to see below in the comment section below, and I can show you guys in another video. But for today, we tested, what did we test? We tested our AC joint. We tested our slap lesions. We've tested our shoulder impingement tests. We've tested for biceps tendinopathy. So these 4 tests are pretty encompassing. Again, they're not going to go through the entirety of the shoulder because there's so many things you can test for. But let's go back to what I spoke about earlier in the video. At the end of the day, it doesn't really matter what's positive in terms of your tests here. It's helpful to help us test and retest for later on when we do our rehab exercise and see if we actually improved. But at the end of the day, like I said, keeping rehab simple, we break it down to either mobility issues or stability and strength issues for our shoulder. And that can be true for almost everything throughout the body. So if you have a mobility issue, we're going to work on mobility. If it's a strength and weakness issue, we're going to work on strengthening your shoulder. And it doesn't matter what the diagnosis of your shoulder is. If you can simplify and leave it to those 2 things, then I'd say 90% of the shoulders will get better. So if you think this is helpful, again, subscribe to my channel. I'll be posting more information on shoulder injuries and shoulder rehab and shoulder tests. If there's anything specific that you want to see when it comes to the shoulder rehab, let me know, because I love working on the shoulder. And again, check out some of these other videos as well, because I show you how I can treat them in the clinic. So dry needling, exercises, and manual therapy. So a lot of different ways we can treat these in clinic. But until next time, guys, remember, I got your back, and I'll catch you in the next video.